I've had L4, L5 fusion about 3 years ago.
Yeah.
The MRI shows that I have L3, L4 uh, stenosis. So I got the following choices.
Mhm.
Uh, you can go to a pain clinic and get 3 to 4 steroid injections a year. Laminectomy,
Mhm.
no. Or you can have another fusion at L3, L4, no.
Hey everyone, it's Dr. Charlie Johnson, physical therapist, and now let me show you how despite having a previous fusion and things not really working out well, and now having adjacent segment issues, spinal stenosis at the level above his fusion, we're able to use the power of movement as medicine to resolve Bill's pain and get him moving better and feeling better naturally without any of that other stuff, which just masks his symptoms. So in this video, again, you're gonna see a case study of a gentleman named Bill. He's already shared a little bit of his story. We changed two simple things. One, we optimize his healing environment. He has trouble getting out of bed and then transitioning. And two, we show him the process of how he can use movement as medicine to resolve his spinal stenosis symptoms. And while there's nothing magical about this specific motion, maybe it works for you or it doesn't work for you, there are many other options, by the way, recognize that the magic is in the process. It's not necessarily what you do, it's why you're doing it, it's how you're doing it. And if you don't understand that, then you'll be doing a random sheet of exercises wondering why it never works. Oh, and by the way, if you'd like to determine the most likely source of your back, butt, or sciatica pain for free, go ahead, check out my Better Than an MRI DIY diagnostic guide. And more importantly than the diagnosis, as you'll see, is identifying the motions that make you feel yucky so that you can fix them using the power of your mind and movement in this case as medicine. Check it out.
Changed to sleeping on a hard mattress, and that seems to have really helped a lot.
Mm-hmm, mm-hmm.
I still notice when I swing my legs over
Yep.
uh, to the edge of the bed, and
Mm-hmm.
I do this with my legs before I get out of bed.
Yep. You rock side to
Um,
side. Okay.
correct.
Mm-hmm.
Um, it's improved fantastically. So I
Mm-hmm.
wanted your advice as to what kind of strengthening I can do
Mm-hmm.
on my in my back and my obliques or whatever it takes to
Sure, sure.
stop that stenosis, those stenosis symptoms.
All right, so you can see that Bill is stuck in diagnosis mode, thinking he needs to treat his spinal stenosis to resolve his pain naturally, but he's already proven otherwise. He doesn't need to change anything about his stenosis to experience significant relief. Case in point, what about sleeping on a firm surface change the amount of spinal stenosis on his x-ray or his MRI? And the answer is it didn't. It couldn't have. It did nothing to change the stenosis, but it did everything to change his symptoms. So what we do instead is we help people identify how their pain experience is showing up in life, in their habits, in their routines, in their belief systems, and then identify, in this case, one motion they can do to aid in the recovery. So we helped him optimize his sleep environment, and then, as we're going to show you, we listened to his story. He said, Charlie, in the morning I do this with my legs. I twist my trunk, and I think my body likes that. So now we help him connect the dots, plug it into a process, and help him identify and see that he is, in fact, just one motion away from natural pain relief. Rather than recreating the wheel, you said something really telling, I think. You said, before I get out of bed, I do this.
Yes. I'm really more concerned about the getting up from sitting. For instance, I've got a board meeting tomorrow that I know I'm going to be sitting for 7 hours,
Well, okay.
and then we'll go for a 3 hour dinner after that. Anyway,
That's okay. No, this is good. So let's figure out the solution and then we'll test it and obviously you can report back. So
okay.
here's what I would do. All right. So before you get out of bed, you do trunk twist right times 15. That's the dose. And then you do a trunk twist left times 15. And then you get out of bed and it seems a little bit better. Is that accurate?
That's correct.
So now what I would be doing if I were you is I would be looking at both of these as independent variables. So this is one and this is one. Now you might see them as one exercise. They're really two exercises. It's one
Okay.
exercise done on the right and the left side of the body.
Yeah.
Makes sense? So now what I'm going to do is this. You don't really have any yucky motions. Is that correct?
Correct.
Okay. Are you
Well, I take it back. Any
back
back
bend?
bend and a
Okay.
back bend. Yeah.
All
When I
right.
close off the spaces.
All right. And how yucky is it?
It is 70.
Could you do 1 rep just to touch the symptoms?
Right there is where it starts to get yucky on my feet, my legs.
Okay, let it off.
Okay.
Okay, now what I want you to do, so we just did a test, right? If we follow process, test, treat, retest, then the test is back bend, and there's X amount of motion, right? So we could see on the screen that you got to a certain point. You're probably aware of roughly how far you could go back. And how yucky was it? Did it just start? Was it like a 10? You just kind of started to feel it?
It was probably 20 to 30.
Okay, that's fine. At X degrees of motion, right, we'll say a 30 out of 100. Now
Okay.
what I want you to do is we talked about, even though we talked about this lying down, you can do trunk twists and seated as well. So
Sure.
what I would do is, can you do 1 rep right now of this to the right, and then 1 rep to the left, and can you tell me yucky or yummy? The first step is to make sure it's a safe motion.
Yummy.
Good. And if you had to choose, they're both yummy, but if you had to choose the yummiest of the yummy, there's 2 chocolate chip cookies here, and one has more chocolate chips. All right? And so if you had to choose the one with more chocolate chips, meaning if you had to pick to do, I'm going to twist to the right, Charlie, or to the left, and I need to do 1,000 of them, which one seems slightly easier, yummier?
The right.
Yeah, right seems like you can go further. That's what I see. I see you being able to go further to the right. It
Yes.
seems easier. Okay, so now what I want you to do is I want you to do a right twist, the right seated trunk twist, and I'm going to have you do 2 times 20 reps. Can you do it right now?
Do you want me to do it seated?
Yeah, let's do it seated. Yep.
Sure.
1, 2, you can grab onto the chair if you want, or whatever. 3, yep. 2 sets of 20, only to the right though. So notice I'm not mixing right and left. Does that make sense?
Yes.
Because
Gotcha.
if you tell someone, hey, we're going to fly right and left at the same time, it doesn't work too well.
Gotcha.
So that's kind of what I'm alluding to, is that you're kind of doing trunk twist right and trunk twist left, and it is helping. But I'm guessing that if you were to just pick one of those sides, you would have a superior result. Now it comes down to determining which of those sides is going to be better.
Okay, that's 20.
Okay, now what you're going to do is you're going to retest. So you just tested your back bend. It was a 30. You got to a certain degree. Then you did this thing, which we know was safe. But does it help? So now we're going to retest that back bend motion to see if we can get further, and if it's less painful, more painful, the same painful. Any answer is okay, by the way. So you just do 1 or 2 reps. You just get an idea of how far you can go back. And what happens?
Easier.
Yeah, you get further. Let it off.
Oh yeah, further for sure.
Definitely further and easier, correct? So less symptomatic and further.
Yes.
So now the cool thing is I didn't do anything to change your stenosis by twisting your trunk in the last 45 seconds to the right, 2 of 20.
Yes.
But we use movement as medicine. We're finding movement preferences, which for whatever reason allow you to move better. Now we can come up with theories about, oh, it wiggles the joints and it does this and it does that. I don't really care. It works. All right.
Yes, all right.
And so what we just identified, what we just proved to you, not guess, but we tested, and we found that you have a yucky motion. This was the most consistent one we could find, right? Then we treated using a yummy motion. We knew it was safe, but we weren't sure if it was going to help. But we had an idea that it potentially could help, because this is what you tell me you do before you go out of bed.
Right.
And I chose to isolate one of the independent variables. I just chose right because I asked you in seated. Seated, you're going to have to drive. So how can you take that thing which you think helps you when you lie down and do it in a different position, which is maybe easier? So on your board thing tomorrow, before you got to get up, guess what you're going to do? You might sit there like this for a minute if you can, or rotate your chair underneath you so that then you can look like you're sitting normal and you're in a right twist.
Aha.
And then you do that right before you stand for, say, a minute or 30 seconds or something. You give a little stretch, but it's pretty subtle. And then you come back, right? And you stand on up. Now, the only argument to that is that we didn't test holds. We could have tested holds. We know reps work. I'm telling you to do a hold because it's probably less obvious. I mean, you could, if you're in some meeting and you're like, nobody cares, everybody knows who I am and they know I do goofy things, right? Then you could do your 2 sets of 20 and then stand.
Gotcha.
You kind of, you picking up what I'm putting down there?
Oh, yeah, definitely.
So that's how you take movement. You identify it as a medicine. You bottle it up, and then we start to figure out dose, frequency. We talked about the timing before you get up, kind of thing.
Right.
Mm-hmm.
Well, that sounds very good.
Cool.
And as far as the scientific method, I was trained as an engineer and then a dentist. So
Nice.
I mean, I believe it fully.
Yep.
Yeah, well, the alternative, some people say, well, what if that, how do you know that'll work? And it's like, well, what's the alternative to not doing it like this?
Right.
It's like, then you definitely ain't going to know if it works. So we
Right.
test, we find a yucky motion, we treat using yummy motion, all informed by the things above. I just chose the right because when you twist it, it seemed easier. We could have picked the left, but we didn't. All right.
Yeah.
So I'm not saying that you can't do the left. I'm just saying the right seems to be proven in the seated position in the reps fashion. You might not like holds as much. Maybe reps work better. So if you can do reps tomorrow during the board meeting, do it. And then we retested. What did we retest? We did this little back bend and we found it went further, increased range of motion. And
Right.
it wasn't a 30, maybe it was a 20, it was less. And
Right.
then we follow some logic. If better, then guess what? We're going to bottle that sucker up. We're going to slap a label on it. And inside the prescription says, right twist. That's your pill. And dose, 2 times 20 reps. Frequency, I would say at least 2, if not 3 times a day. And then the timing, before getting up or before getting out of bed. Your
Oh,
transition.
really? Okay.
So you could sit on the edge of your bed and do this.
Oh, yeah, sure.
That
Easily.
idea. And the cool thing about this is that now you know it works because we proved it.
Right.
You're not guessing, but we tested. And it's very simple and it's pretty low key. And so now you can do your 2 sets of 20 reps and time it appropriately. And that's how you can use movement as medicine to improve your ability to get up out of bed and or get up out of the chair after sitting for a while, or get up out of the car after you've had a long ride. Any of those scenarios, transitional scenarios, this has proven, at least in the moment, to be something that's valuable.
That's wonderful. Thank you.
That's the scientific method applied to motion exercise rehab.
If you're not being systematic and you're not being scientific, then what are you doing? Random in, random out. If you don't have a process, or whoever you're working with doesn't have a process for determining what you need to do to solve the problem and can't prove to you immediately in the moment that what they're doing is working, well, then it's just hope and pray. And hopefully you can see how, regardless of the diagnosis, if you understand how your pain experience is showing up for you in life, and again, the habits, the routines, the belief systems, oftentimes what you don't know, then you'll constantly be picking the scab. On the other end, if you're doing a random sheet of exercises thinking that that's going to work, well, then you'll just be lost and confused. And so we optimize things mentally and physically. We teach you how to self-assess, and we identify the one thing via the process I just showed you. I call this hunting for motion, so that you know what you're doing is working, it's safe, and again, can lead you to natural relief. Hopefully this was helpful. Again, this is Dr. Charlie Johnson, physical therapist. We work with people all around the world dealing with back, butt, or sciatica problems. If you're interested in working with us or having me review your case to see if we can help, just check the link to apply to work with us in the description. Thanks.